So, yes, we are navigating the best choices and best options for our patients throughout our journey, providing them the best option for their refractive needs. Um, we all know that we got a lot of options nowadays, starting from the surface ablation, femtolasic, the lenticular extraction, and after going through all this journey, I found myself to have the femtolasic as one of the first choices, providing very predictable results my practice. I don't have any financial disclosure or interest in any of the materials or products to be mentioned in this talk. I started femtolasic in 2010 with the IFS platform. Still one of the best machines, can give the very smooth cut and very predictable results. In 2016, I got the Z6 femtolasic LDB machine, still with me. Happy with it, cutting the time of the procedure almost 20 to 30% less than the IFS and other models that have more time to do the procedure. In 2019, I have the Z8 platform, including the lenticular extraction and other features of that great machine, actually, including, of course, the clear, which do the lenticular extraction by femto-LDB. We know the lenticular extraction can be done by various machines, including the VisuMax, which has very well established SMILE procedure. The Atos Elita, as well as the Z8, can give you the lenticular extraction very well. Lately, we have the Elita platform. I like the machine very well. It gives very smooth. It is the updated, actually, machine of the IFS, and we know how smooth cut we got from the IFS, and then the Elita machine, giving the silk procedure as a lenticular extraction as well. A very small video. I don't know how to, just to illustrate the lenticular extraction provided by two different machines. The first one is clear, which is done by the LDV Z8. Has a little bit not as smooth as we see in the Elita, but it's very predictable and very efficient machine, giving the lenticular extraction its effort and give the option for the patient. The other video is a silk, which is the smooth lenticule, smooth incision lenticule keratoplasty procedure done by the Elita, and it has very smooth dissection to give you really nice results. Nowadays, we have more than 10,000 femtolasic flaps created in our platform, and we have done more than 500 tunnels and trachonial rings, including the keranatural keranatural rings that provide very nice results for the keratoconus lately. The astigmatic keratectomy also was done by such machine and keratoplasties. So why I'm choosing the femtolasic as one of the best options? We know that with the refractive errors varies from myopia, myopic astigmatism, and hyperopia, and even high hyperopia. The femtolasic give the best predictable results on most of the refractive errors we have in our practice. We know the hyperopia is not really suitable to be done in the surface ablation or the lenticular extraction, so we are having the femtolasic as one of the best options could be offered to the patients. Astigmatism as well has the same issue. The results with the femtolasic is much more predictable. So I'm not going to go through minor details of the of why we need that the hyperope and astigmatism. We are having the last two slides as a recommendation. This is a study showing the quality of vision of LASIK, PRK, and femtolasic, and it shows clearly that the femtolasic showed an excellent optical performance through the HD analyzer. Another study showing the long-term results with a small incision refractive lenticle extraction versus the femtolasic. Yeah, and in that study, it showed that the results from the femtolasic and lenticle extraction is very, very comparable, but the lenticle extraction has more favorable in terms of the dry eye symptoms post-operatively. So still if you have moderate myopia or high myopia, the favorable procedure is the lenticle extraction as seen in this study. So we are having some frustrations in our cases, yes, but still we can manage with the gold standard femtolasic. I will not even go through the PRK. We know the PRK is having a very high tendency of the haze and regression. In various studies shows the very high tendency of regression and haze if you have high astigmatism or high myopia. Many studies are showing that.
Can you summarize? Yes.
Yeah, it's the same. The last. Can I have the slides, please? Yeah, this is a study we have done it, and it shows very high satisfaction rate among our patients in hyperopia and astigmatism, and the even up to 3 to 4 years post-operatively. And the last recommendation, I will just mention that in our new laser suites, we have an improved stability hyperopic laser treatment. We have better registration, centration techniques, and pupil centroid shift compensation. And we have also smart pulse technology that can enhance the results. Recommendation, if you want to tackle the hyperope and astigmatism, you have to limit the hyperopia up to 5 diopter. And the maximum post-operative keratometry should be not reach more than 49, and consider phakic lenses if you have to do the phakic lenses or even clear lens extraction rather than doing corneal ablation. The conclusion, the clinical observations and several studies has shown that femtolasic is superior to surface ablation. Even the lenticle extraction, especially for the hyperope and very high astigmatism, and due to the high incidence of corneal haze and regression, alternative options in treating high hyperope and high astigmatism should be considered, like the phakic lenses and toric ICLs, if you have to do. Thank you so much.
Thank you, Dr. Khalid. Before Artashaz we're going to talk about SupraCool, I have 2 questions for you.
Yeah.
You can get ready. Yes. So if we go from the title of the presentation, why femtolasic? So if it's a normal Moria keratome and you have, say, for example, -4 astigmatism. So if we compare between Moria and femtolasic, so both will going to give the same results. But if we have like something like hyperopia patients and we are going to for Moria, so the instant that you have a residual is very high because you cannot choose the size as you can choose in the femtolasic. So in your experience, what is the minimal thickness of the flap that you can go for femtolasic?
I go usually up to 100. I even go 90 in some very seldom cases, but without hesitancy, I choose to 100 rather than 110 if I need to do that, without any noticeable complications. So,
And if you have an astigmatism, say -4 astigmatism, you prefer the manual or the femto?
I don't have the manual, by my memoria, but definitely I always prefer the femto basic procedure. Yeah.
So this is why, because if you have an astigmatism, you need a larger cut to treat the whole astigmatism, not to decrease the optical zone. So this is why the femto is higher than the.
Yeah.
Thank you.
Even the good thing about it, you can reach up to 9.2,
Yes,
9.3.
exactly.
Very predictable results. You can choose whatever optical. If you need to go very large optical zone, you can do it easily.
Thank you so much, Dr. Khalid. Thank you.